If you are over 60 and you take vitamin B12 every single day, pause for a moment and pay close attention. This is one of the most common questions I hear in my clinic. Patients look at me and ask, "Doctor, I take B12 faithfully. Why am I still exhausted, mentally foggy, dizzy, or dealing with numbness and tingling in my hands and feet?" Not long ago, a 68-year-old patient asked me this exact question. He had been taking vitamin B12 consistently for more than 7 years. His blood work appeared normal, yet his energy continued to decline, his balance felt unsteady, and his memory was noticeably worsening. What surprised him most was learning that he was not actually deficient in vitamin B12 at all. The real problem was that he was taking it in a way his body could no longer use effectively. Emerging research now shows that a very common mistake with vitamin B12, especially in adults over 60, can significantly block absorption and quietly damage nerve function over time. I'm Dr. June Romeo, and today I want to explain what that mistake is, why it is so often overlooked in routine medical care, and how to take vitamin B12 properly so it truly supports your brain, your nerves, and your long-term energy. Before we go further, I encourage you to share your age and where you are watching from today. If you are taking B12 but still dealing with fatigue, brain fog, balance issues, or numbness, your experience may help others who are silently struggling with the same thing. Many people assume that a normal B12 blood test automatically means everything is fine, but for adults over 60, that assumption is frequently incorrect. Vitamin B12 plays a critical role in nerve signaling, brain health, red blood cell production, and energy metabolism. When your body cannot access enough usable B12, nerves begin to malfunction, and the earliest warning signs are often tingling in the hands and feet, problems with balance, persistent fatigue, memory lapses, and mental fog. The core issue is that the body's ability to absorb vitamin B12 declines significantly with age. By the time we reach 60, more than half of adults have reduced stomach acid. That stomach acid is essential because it separates B12 from food and supplements so it can be absorbed. Without sufficient acid, much of the B12 you swallow simply passes through your system unused. I saw this clearly with a patient named Margaret, who was 71 years old. She complained of burning sensations in her feet and frequent dizziness. Her physician ordered a B12 test, which came back at 420, a value considered technically normal. She was told there was nothing wrong, yet her symptoms continued to worsen. What most people are never told is that a standard blood B12 test does not show how much B12 is actually reaching your cells. It only measures how much is circulating in your bloodstream. In older adults, B12 can look normal on lab work while the nerves themselves are still being deprived. This explains why so many seniors take B12 for years without experiencing real improvement. This leads us to the first major mistake. Most older adults take vitamin B12 as a regular tablet, swallow it with water, and assume it will be absorbed like any other supplement. For many people over 60, that simply is not the case. Proper B12 absorption depends on a stomach-produced protein called intrinsic factor, and with age, intrinsic factor production often declines. When intrinsic factor is low, swallowed B12 tablets are poorly absorbed. This is not a rare situation. It is extremely common. The 68-year-old man I mentioned earlier was taking his B12 exactly as instructed every morning. The dose was appropriate, the brand was reputable, yet his nerve symptoms continued to progress. When we changed only the form of B12, not the dosage, his symptoms began improving within weeks. This is why the form of vitamin B12 matters just as much as the amount. The second mistake is equally common and often hidden in plain sight. Many people are taking the wrong type of B12 altogether. If you look closely at most supplements on store shelves, you will repeatedly see one form listed, cyanocobalamin. It is inexpensive, chemically stable, and unfortunately the least effective form for many older adults. Cyanocobalamin is a synthetic version of B12 that must be converted by the body into an active form before it can be used. That conversion relies on healthy liver function, efficient enzymes, and adequate antioxidant capacity. In adults over 60, this conversion process frequently slows down. I saw this with a 72-year-old patient named Robert. He had taken cyanocobalamin for years. His blood levels appeared acceptable, yet he struggled with numb fingers and difficulty walking. When we switched him to methylcobalamin, an active form of B12, the difference was clear. Within 1 month, his balance improved. Within 3 months, the numbness had decreased significantly. Research consistently shows that active forms such as methylcobalamin and adenosylcobalamin are absorbed and utilized far more efficiently in older adults. Another issue that rarely gets discussed is how B12 is taken throughout the day. Many seniors take a single dose in the morning and assume that is sufficient. Vitamin B12 is water-soluble and cleared relatively quickly from the bloodstream. In people with absorption challenges, one daily dose may not maintain levels long enough to support nerve repair. There is also confusion surrounding injections. Some believe injections are the only effective solution, but that is not always true. Injections can be useful for severe deficiencies, yet high-quality sublingual B12, when taken correctly, can be just as effective for many older adults. Sublingual forms bypass the stomach and intrinsic factor entirely, allowing absorption directly through oral tissues, which is particularly important for those with low stomach acid or digestive issues. The key point is simple. If you are over 60, swallowing a standard B12 tablet may produce normal lab values, but still fail to protect your nerves. The third major mistake surprises many people because it has nothing to do with dose or supplement form. It has everything to do with timing and consistency. Many individuals take vitamin B12 only when they feel especially tired. They skip days, stop when symptoms ease, and restart weeks later. Nerve tissue does not heal in this stop-and-start manner. Vitamin B12 is not a stimulant, it is a repair nutrient. Nerves require a steady, daily supply to rebuild myelin, the protective coating that allows signals to travel properly. Irregular dosing interrupts that repair process. I observed this pattern in a 70-year-old patient named Elaine. She took B12 only on days when she felt exhausted. She noticed brief improvement in energy, but her numbness, balance problems, and memory issues never resolved. Once she began taking B12 consistently every single day, her symptoms stabilized. After 2 months, the tingling stopped progressing. After 4 months, her balance improved. Timing also matters more than people realize. Many seniors take B12 late at night, which for some interferes with sleep. Poor sleep raises cortisol, increases inflammation, and slows nerve healing. For most older adults, B12 is best taken in the morning or early afternoon, supporting daytime energy without disrupting sleep. Hydration plays a role as well. Vitamin B12 works inside cells that depend on proper fluid balance. Chronic, mild dehydration, which is extremely common in older adults, reduces nutrient delivery to nerve tissue. If you are taking B12 but rarely drink water, the benefits will be limited. Medications are another overlooked factor. Acid blockers, metformin, and certain antibiotics can interfere with B12 absorption or function. This does not mean stopping prescribed medications, but it does mean that B12 support must be adjusted accordingly. By now, a pattern should be clear. Most seniors are not making just one mistake. They are making several small ones at the same time. Each error reduces effectiveness slightly, but together they can completely cancel out the benefit of vitamin B12. At this point, it is helpful to outline the correct approach to B12 supplementation for adults over 60, based on what consistently works in clinical practice. The first consideration is form. Active versions such as methylcobalamin, or a combination of methylcobalamin and adenosylcobalamin, are generally the best choice because the body can use them immediately without conversion. Relying solely on cyanocobalamin, especially when nerve symptoms are present, is often ineffective. The second factor is delivery. For many seniors, swallowing a standard tablet is not enough. Sublingual B12, placed under the tongue and allowed to dissolve slowly, bypasses common absorption barriers and can dramatically improve results. Dosage also matters. Low doses frequently fail to overcome absorption issues. Many older adults need higher amounts, often in the range of 1,000 to 2,000 micrograms daily, especially in the beginning. Vitamin B12 is water-soluble, and excess amounts are safely excreted. Consistency is critical. B12 must be taken every day. Nerve repair is slow and gradual, measured in weeks and months rather than days. Timing should support your natural rhythm, usually earlier in the day. Supportive nutrients matter as well. Vitamin B12 does not work in isolation. Folate and vitamin B6 often play supporting roles, though synthetic high-dose folic acid should be used cautiously. Monitoring progress should focus less on lab numbers and more on real-world changes such as improved balance, reduced numbness, and clearer thinking. I once treated a 75-year-old woman who followed this exact approach. After 3 months, her lab values changed only modestly, but her walking improved, her falls stopped, and her confidence returned. That is what true success looks like. It is also important to recognize the limits of B12. Long-standing nerve damage from compression, spinal degeneration, or diabetes cannot always be fully reversed. Poor blood sugar control and chronic inflammation can also blunt results. In some cases, symptoms that look like B12 deficiency stem from other causes such as spinal issues or nerve entrapment. I remember a 73-year-old man who doubled his B12 dose after reading advice online, only to see no improvement. Further evaluation revealed spinal stenosis causing physical nerve compression. Once the correct diagnosis was made, his B12 supplementation became supportive rather than disappointing. When everything is brought together, the message becomes clear. For adults over 60, vitamin B12 can be profoundly beneficial, but only when it is used correctly. A normal blood level does not guarantee healthy nerves. The right form, the right delivery method, an effective dose, proper timing, consistency, hydration, and attention to underlying health issues all determine whether B12 truly works. Many seniors believe B12 failed them, when in reality, it was never given the chance to work properly. A woman in her early 70s once told me after adjusting just a few aspects of her routine that she finally felt steady again, trusted her footing when walking, and no longer lost words mid-sentence. That difference came not from taking more supplements, but from using the right one in the right way. If you are over 60, vitamin B12 is not optional, but how you take it matters far more than most people realize. I encourage you to look closely at your current routine and ask yourself whether it is genuinely supporting your nerves and brain or simply checking a box before moving on. Before you move on, take a moment to reflect honestly on what you are doing right now. Ask yourself whether your current vitamin B12 routine is truly supporting your nervous system and brain health, or whether it has simply become another habit you follow without real results. Many people never stop to question this, and as a result, they live for years with symptoms that could have been reduced or stabilized. If you are taking B12 and still dealing with fatigue, tingling, balance problems, or mental fog, that is your body telling you something important. It is not a sign of failure, and it does not mean your body is broken. It means the approach needs to be corrected. This is why awareness matters so much, especially after 60, when small adjustments can make a meaningful difference in how you feel and function every day. I encourage you to take a closer look at the form of B12 you are using, how you are taking it, and whether you are giving your body the consistency it needs to repair and protect nerve tissue. If you have been swallowing a standard tablet and hoping for the best, understand that your effort has not been wasted, but it may not be enough. Your body's needs change with age, and your supplementation strategy must change with them. This is not about taking more pills or chasing quick fixes. It is about aligning what you take with how your body actually works now. I want you to know that improvement is often gradual, not dramatic. Nerves heal slowly, and progress can show up first as stability rather than sudden relief. Tingling may stop spreading, balance may feel slightly more reliable, thinking may become a little clearer before it feels sharp again. These are meaningful signs that the process is working, even if blood tests barely move. Too many people give up too soon because they expect instant results, but the body does not operate on a deadline. It responds to steady, correct support over time. If you are unsure whether your symptoms are related to B12 or something else, do not guess and do not self-diagnose endlessly. Persistent or worsening symptoms deserve proper evaluation. Vitamin B12 is a powerful tool, but it is only one piece of a much larger picture that includes spinal health, blood sugar control, circulation, sleep quality, stress levels, and overall inflammation. Addressing these factors together creates the environment where B12 can actually do its job. Ignoring them forces B12 to work against the current, often with disappointing results. I have seen countless seniors regain confidence simply by understanding this connection and making informed adjustments instead of random changes. What matters most is that you do not dismiss your symptoms or accept them as an inevitable part of aging. Feeling unsteady, foggy, or numb is not something you should automatically tolerate just because you are older. In many cases, these symptoms are signals, not sentences. They are your body asking for the right kind of support at the right time. When that support is provided correctly, the nervous system is often more resilient than people expect, even later in life. This is why education is so important. The more you understand how nutrients like vitamin B12 actually function in the aging body, the more empowered you become to make choices that protect your independence, mobility, and clarity. I encourage you to take what you have learned and apply it thoughtfully. Look at the label on your supplement. Consider whether sublingual delivery might serve you better. Commit to consistency rather than occasional use. Pay attention to how your body responds over weeks, not days. Support the process with hydration, movement, and good sleep. These steps may seem simple, but together they create the conditions for real change. If this information helped you see your health from a new perspective, consider sharing it with someone you care about. Many older adults are doing their best, taking their supplements faithfully, and still wondering why they do not feel better. Sometimes all it takes is the right information to turn confusion into clarity and frustration into progress. You are not alone in this, and improvement is often closer than it appears when the approach is corrected.